But the main focus of tonight, actually, and our chat for this evening is innovating One Health. And One Health, for me, was a relatively new concept. And well, I think the people who we're about to talk to are going to fill us in a little bit more on that as well. So Sara Perestrelo is cracking One Health podcast in the media industry. She can certainly tell us a little bit about that. Soham Datta is an immuno-oncologist, entrepreneur, and also podcaster. So we've got two good talkers, that's for sure. Bernardo Gomez is another One Health expert. Chaitanya Dhumasker is co-founder and CEO of monitorfish. So the concept of One Health, Sara, maybe I'll bring you on first. Like, tell us a little bit about yourself and a little bit about your work. Sara, are you there? Can you hear me? Chaitanya, we have you on the screen at the moment. Great.
Yeah.
Let's start with you, Chaitanya. Sorry about that. Like, tell us a little bit about your work at monitorfish.
So firstly, thank you for inviting me for this event. For this concept of One Health is quite new to me as well. But at the end of the day, we are all what we eat. And we at monitorfish deploy artificial intelligence at fish farms. So what we actually do at monitorfish, we have a lot of fun. We have let's say designed a new underwater camera which can see the fish, and it can detect if the fish is feeling stressed. It can determine what's the weight of the fish. It can determine how is it growing, and these inputs can help fish farmer to actually take right decisions in their culture. We kind of had transparency to the fish farms that was quite missing. This is what we do in a nutshell. It's quite a small team. We started off 3 years back. We're still a young startup based out of Berlin, and we're always looking for good talent. So if anyone out there quite interested in this field, in the field of AI, in machine learning, in optical detection, I'm always open to talk.
That's quite an interesting combination, Chaitanya, of artificial intelligence and fishing, from one very ancient industry to one very, very new industry.
Yeah, that's true. The whole aquaculture industry is so traditional. They kind of grow them in kind of confined places. They try to replicate oceans there. The only view they have is to peep in the tank and see how the fish is growing. Some of the farmers go extreme. They just pick out each and every fish and try to measure them manually. I think we found them totally ridiculous how farmers were doing it. They were actually using tapes and checking the length of the fish. This could be easily solved using stereo cameras, and this is something what we do. And by doing that, we just have the whole fish in 3D. Then we can simulate the several conditions around the fish and around its growth parameters. So we can recommend so many. We can add precision to the fish farming, which was quite lacking.
Yeah. What is for you, Chaitanya? What does One Health mean to you? Like, why is this an interesting topic for you, particularly?
I come from India, actually, from part called Goa, where we eat fish every day, and the whole idea of this is fact. This is nothing to be not a secret anymore. There is no fish left in the ocean. We have overfished them, and most of the fish is about to collapse. And the only hope that we have that we will get this source of protein is through aquaculture. But if you look at the whole aquaculture industry, it's done in such a blind manner. There are blind spots in there. So farmer does not know what exactly needs to be done. So he keeps experimenting with the fish, and this experimenting leads to death of fish. It leads to adding more of chemicals and pesticides, and this is all then sold in the supermarkets. So there is lack of transparency how this fish is grown. There is lack of knowledge around the word fish welfare. So this is something that we want to bring in, and we want to solve that piece of the puzzle. And this, when a healthy fish is eaten, I think we that's my approach or my contribution to one health of the world.
Well, it's interesting. So Dr. Oshin just asked a question there, like, really interesting concept. Worried about the growing use of tech in animal culture and the impact of fish farming. How does it? again, if we're talking about One Health, we're talking about animal health, human health, and also the environment as well. Like, how do you respond to that?
Look, we are right now in a stage or an era, I would call, where there are technical developments in everywhere. It's only a matter of time someone takes those pieces and start implementing it. And then what are your intentions doing it? The use of tech in animal culture will only make it better. Right now, there is so much less tech is used in animal culture. It is still intrinsic knowledge based, and there are still approximations in that, so that the whole knowledge management part is missing there, the whole precision part is missing there. This leads to several errors, and therefore at the end of the day, any animal culture farmer wants profit out of his business because his business. And in those efforts to make profits, he takes several wrong decisions, which ultimately leads to ill effects on the animal. So if we can save him, and if the technology is out there to guide him take the right steps in terms of animal welfare, I think this is much appreciated within the industry.
So with the technology, you can kind of monitor, make sure the animals are healthier as well, and also monitor their effect on the environment. Yeah. I just want to bring in Sara Perestrelo. Tell us a little bit about, when we're talking about the overall subject of One Health. Tell us about your perspective. How did you get involved in this topic? Sara, can you hear me? I'm not sure you can hear me yet, Sara.
I don't think Sara can hear you, Declan. Sorry.
She can't hear me at the moment.
Sorry.
Yeah. Okay.
I can hear you. I'm sorry.
You can hear me. Okay. Great.
I'm here.
You're just reading email. Okay.
No, I wasn't. I was muted. Yeah, I was like, yeah, forget it.
Okay, no worries. No, I was just asking you. Tell us about how you got involved with this topic, Sara, and what made you start your podcast.
Yeah, so I'm a veterinarian by training. So for me, this One Health concept was a very normal, natural. I just heard about it for the first time in my public health classes, which is quite interesting actually, because I have a lot of friends who are medical doctors, and they were studying basically in the same campus as I was studying, and they were not hearing about this. While I was listening to One Health in my public health classes, they didn't hear about One Health, which is a bit tells a little bit of this about this concept, because it's very much towards, or at least it became very famous within veterinarians. And then later now we see more medical doctors and other stakeholders talking about this, which is really great, because One Health is about multidisciplinarity. It's not about having only vets talking about this. So yeah, for me, it came naturally while I was studying. And then I just decided, that for me, it made a lot of sense. And I decided to also, I took a break actually from all of this, and I worked in innovation and digital health, did design thinking, and lately I came back to One Health because I just realized that it really was meaningful for me. So I also started doing the podcast, Cracking One Health, last year. Currently, I'm working for the German Federal Institute of Risk Assessment, also doing research in One Health, and more specifically in antimicrobial resistances. So I'm trying to not only professionally do this in a scientific way, but also doing on the side with my projects. So I have the podcast, and I also have the One Health Mentorship, which is basically a combination of design thinking and One Health, where I try to support young professionals to really find their voice and their own projects in One Health. So really developing innovative approaches within One Health.
Okay, and I want to come back to ask you a little bit more about the mentorship thing as well. I'm going to bring in Soham Datta. Soham, tell us a little bit about the work that you're doing. You're working in oncology and oncology research.
That's correct. I am a cancer immunologist. I am actually the person that Sara was talking about, medical doctors who I admit we have tunnel vision, and we don't look beyond what we need to, and that's been a problem. I am actually, unlike the two, I have known the One Health concept since school, I'd say, because back in Hong Kong, I was in middle school probably when the SARS epidemic happened, or pandemic. And then there was this concept of One Health. It was more like an hypothesis then, and then now it's good that people are coming back to it, and then they know that it's a fact. It's more a reality than just a theory. So I have moved from being a clinical doctor, to somebody who does medical research. And during my PhD, I have seen myself wanting to venture out into connecting medical research and climate change and medical research, and things like One Health and the environment around us. And surprisingly, there hasn't been much there. I still remember a conversation with my supervisor back in Ireland. She was like, "You do want to get funded, right?" And that's the amount of apathy that a lot, I shouldn't say all, a lot of medical doctors or medical researchers have towards the environment or everything else, because they think there's somebody else to figure that out. And then so I thought, rather than a top-down approach, it's good to have like a bottom-up approach. That's how I started a few of the organizations. I have the podcast. It's called No Place Green Enough. We do more of storytelling, and nice that Chaitanya brought this up. I didn't know he was working with that. Our latest episode is actually about the bycatch issue in the Bay of Biscay between France and Spain. And it's so true that there are no more fish to fish, and we got to stop subsidizing the fishing industries somehow. And I totally agree that we, if you have to go forward, we have to bring in tech and other things. And then, other than the podcast, I started a food saving organization, because in Sweden, food is very expensive, and food is remarkably very it's just wasted in awful amounts. And for a country that takes a lot of pride in being the sustainability forebearer of Europe, I think they have to do much better. And there, I started this organization because, there has to be a balance between health and food saving as well. So instead of food ending up in bins, it's nicer if a lot of volunteers take them to food banks that people in need, marginalized communities. There's a huge migrant crisis here. There's a lot of people who do not have access to good, clean, fresh food. That's what we are tackling as well from that. And going forward, I'd like to just raise awareness, because there's this whole generation before us who have just taken it too easy on themselves, and unfortunately, they're the policymakers. They stay in these beautiful glass houses and not looking outside what's happening, what's left of this earth after they've gone. Yep.
And it's that kind of holistic approach, I think, that sets One Health apart, isn't it? Like, we're looking at things not just in terms of animal health, human health, environmental issues, and I think even just the food issue, right? Food waste is already feeding into a lot of that as well. Let me just bring in Bernardo.
So true. Yep.
Sorry, let me bring in Bernardo Gomez a little bit. Bernardo, I see we have another guest behind you there as well. You have another audience member in the back.
Yeah, I'm sorry. I have to say, I have my kid has been sick, so I had to stay with him. So he's my assistant in this presentation.
Brilliant. He's going to do a great job.
He's cooking with
fantastic.
Something
Sustainably, I hope.
Yes. So I'm sorry, most of all.
This is normal life these days, I think.
Yeah. Thank you for the invitation. Come on. Anyway, I just wanted to say thank you for the invitation. I've been into One Health just recently, but sorry, just a moment. Gilles, só pouquinho. Agora para falar de português. But what I wanted to say is
it a little boy or girl, Bernardo? Sorry.
It's a little boy, 2 years and 8 months.
Yeah. Oh, it's 2 years. Okay, so it's hard to get him to contribute to the conversation as well.
Okay. So let's move on. So, but what I wanted to say is I'm going to pick up a little bit on what Sara said of the lack of involvement of medical doctors on this subject. I've been recently on an event of One Health with a lot of veterinarians of Portugal, and with initiatives also in the EGPH initiative as well. So what I wanted to say at this point is I think we have to just take a step back and think there are a lot of things that have been around a lot of time, for a long time. We had health in all policies, we had things like global health, we had things like planetary health. So One Health just crosses a little bit, overlaps with these kinds of subjects, with these kinds of approaches. Sorry, guys. I have this assistant talking loudly, but he's just cooking. What my area specifically is working in prisonal tuberculosis. So I'm looking to the hypothesis of elimination of tuberculosis in Portugal in 10 to 15 years. But what I felt is regarding specifically One Health, and one of my subjects of a book that will be coming up in 2022 about several subjects of One Health, and I wrote a chapter about epidemiological surveillance. Gio. Okay. So what I felt is a lack of integration of surveillance between animal, human, and environmental health. So what I think is, okay, we can talk about policies. We can talk even back to 20th century, talking about big disasters like Minamata and the poisoning of fishes and all the damage it has done to people and cats, if you remember that particular incident. What I would like to say to people that are new to One Health is that there are a lot of things that have been going on throughout the years, and there is a story of thinking constructively in interactions between human, animal, environmental sciences. What I think is, and the scope of what we're discussing today, what we can move on is, okay, there are technologies and there are investments and there are initiatives that can help push forward the agenda of crossing different objectives in different areas. One of the things for me, the start, because I think this perspective of One Health is uneven across Europe. You have the north of Europe with a stronger interest, center north with a stronger interest in One Health with bigger history. You have the east with less interest in this thematic. And you have the south, the Portugal, Spain, Italy, Greece, with also a little bit of delay. So I would like to push forward the integration of surveillance and data surveillance between environmental, human, veterinarian sources, even at the lower scale, because there are events that are connected. And if we are not aware of those crossings, of those overlaps, we are missing opportunities of improvement. So that will be the main message so far.
I would like to kind of get the guys to reflect on maybe Sara, coming back to you a little bit as well. Why is this integrated approach? Why is this interdisciplinary approach so important?
Well, One Health was born as a concept as we know it today in 2004. It was a group of veterinarians from the Wildlife Conservation Society that gathered in New York City to talk about the recent disease outbreaks that we experienced in the past years: avian influenza, mad cow disease, so many things that happen in the past years that push them into let's talk about these problems, because they could see the clear connection between wildlife and human health. Because of course, if we start deforestation, if we start encroachment on environment, if we start destroying the normal habitats of wildlife, we'll see that suddenly those viruses that were very common there and just stay there, suddenly they will be in close contact with us. And COVID-19, of course, is also one of those topics now that we can see it. It's one of the silver linings that we can see from this pandemic is suddenly people start talking about public health and One Health. But it was there since 2004 as a formal concept, and it came from the veterinarian side. But they saw the need of integrating other actors in this conversation. So it was One Health was born because it was needed to have interdisciplinarity and multidisciplinarity. Mm-hmm. Without it, it doesn't make any sense. So it was a need to really expand these conversations into other areas, integrating first the environmentalists, then medical doctors, to really talk about and have this common ground, this common conversation, this common platform to really talk about these topics. And I see that nowadays also it grows to social sciences, for instance. We need to have anthropologists, we need to have other people supporting us because they know other things that we don't know. And we cannot solve these wicked problems, these pandemics, these disease outbreaks alone. We as vets cannot solve it by ourselves. And the medical doctors will have much more an easier time if we have the two integrated.
I got to bring in Soham. He's laughing here, like he's got to have something to respond to that. Like,
I like how the vets take all the glory and marginalize.
Well, this is just because this conversation started a lot from the veterinarian side, but they saw the need to integrate other actors.
No, I totally agree with you, Sarah, and it's kind of true. It's just that when vets speak, there are more people listening. When medical doctors speak, they're just nobody wants to listen to them because you find it all the time. Just I'll give you a small example. You take your dog to a vet and you tell them what to do, and they're like, "Oh my God, I have to save my dog or my cat," and they follow everything to the T. And then the medical doctors go and tell you, "Hey, smoke is not good for your health." And like, what the fuck does he know? And they just move on with it. So I think what Sarah said is very true. And it's not that the medical fraternity, especially researchers and doctors, that they didn't know it. It's just the mainstream media or the people who's putting it out on the information things, the media houses and everything. They don't put it. The concept of One Health has been described by medical doctors or the medical fraternity or medical researchers for a long time. Zoonotic diseases is as old as 100 years old. All these different viruses, all these different things that people get to know now, like, somebody ate a bat and you have this pandemic. No, this has been in literature, this has been in research, this has been in conference for a really long time. And these viruses are nothing new. They have existed for a really long time. It's just that our policymakers and the media or the information that we consume does not have these things because they didn't think it's interesting enough. So, for example, if you take just something like SARS or even SARS-CoV-2, like the COVID virus, they have been in our environment. I mean, medically, you could say for like with research, evidence-based medicine, you could say for like at least 100 years, but then you could estimate it there like goes back centuries. It's just that now there is such a big conflict between man and environment and animals, and we are encroaching on things that we haven't in the past. And like Chaitanya brought up the thing of overfishing, it's like where do we draw the line where we encroach into nature so much that it starts inhibiting ourselves, our health, and then environmental health and human health and animal health and everything is so interconnected. That's why we have those things called like social and preventive medicine and things like public health or global health that have tackled this in the past. It's just, I think at this moment, I think there's a question up here as well where they ask what are the stakeholders. So in One Health you have collaboration, communication, and I think it's very essential that we bring in not just vets and public health people and environmentalists and anthropologists, but also the policymakers, the people who will take those steps. Also, even activists. I know a lot of scientists are scared of activists, and my friends or colleagues have been like, no, let's keep them away. No, it's important. The media, I think it's very essential, the information we're giving out to people, and not just a holistic approach, but also something very evidence-based, so we have to be better science communicators, each one of us here. And that's something I think we have lacked over the past few decades.
And Chaitanya, we're just talking a little bit again about that breakdown of systems as well. I mean, do you feel like that fishing is somehow on the front line of that?
Yeah, I just want to complete Soham's joke. I think by the time someone listens to you, he's already dead, right? So that's too late. But look, I was also looking at one of the questions which was popped up on the screen. The whole I'm an entrepreneur at the end of the day, and telling someone not to do it is quite an easy solution, but most non-practical solution ever. People are looking for solutions. People are looking for alternative. We can say close the fishing industry, but there are lots of people associated with them. What will they do? How will they feed? We have other social problems associated with it. So that's not a way to go. But if we provide them a solution, which is an alternative, where they can still feed in their families, and then it's something else. So my approach to that is always the consumer drives lots of policies. and even policies makers bend towards the need of the customer. All the industry are working towards what the customer wants. We have come up from an age where Henry Ford once quite famously said, "You can get cars in all colors as long as they are black," to people who are saying, "I can customize you that particular feature." So we are very customer-centric industry right now, and we should take this into consideration. If customer wants it, companies do it for you, and we should take advantage of it. It should be driven from the customer side. So I think that should close the loop. That will push all the stakeholders. It's nice to see people out in protest asking for something, and next day people are asking, "Whoa, what was that about?" So that's the age that I want to avoid.
Thank you, Chaitanya. I just responding. We've got a couple of questions coming up in the chat, guys. If you want to just have a look here. One question is: do you think it's a better solution to research cultured meat more so that it becomes more accessible than to invest more in animal agriculture research?
From a medical point of view, that's definitely yes. It's definitely, and I totally agree with Chaitanya. It's very customer-driven industry, and I think all industries are. And it's very important that we find sustainable solutions, because at the moment, a lot of people see this as binary. It's 0 or 1. So they think, okay, the only way to get beyond this is to stop this, or just avoid this. It's very essential that the whole point of One Health is not to just have a shift from one extreme to the other, but find some middle ground with sustainable solutions that we could be using in the long term. So I think from a medical point of view, this definitely makes more sense. I have recently been in a conference in Copenhagen, and there was a lot of that happening there. I think it will take some time to reach there, because there's a lot of social and cultural barriers to cultured meat. But I think we'll eventually do have to get there in a way. I mean, I don't think that'll be the only solution, but definitely one of the many solutions. And there does not have to be one solution, because it's a very pluralistic society, and we would want it that way going forward.
I just wanted to go to that question and back to Chaitanya regards to customer incentives. First of all, I just wanted to make a comment regarding letting veterinarians in the center, front and center in One Health. I'm perfectly comfortable with that perspective, being very supported even for that, because one of the things, and picking on Chaitanya comments on incentives and customers, is one of the ways to make the One Health agenda go forward is picking up specific questions. And we've, in the last meeting, for example, discussed specific ways to decrease Brucella cases in animals and humans, or Mycobacterium bovis in animals and humans. And these are different questions with different incentives and different things to be addressed. So one of the things that Chaitanya has put up correctly forward is thinking about behavioral perspectives and proper incentives is very, very important. One of the things that sometimes is lacking in simplistics, sorry, in simplistic approaches is lacking the system thinking. So in complex systems, and thinking that things do not move in a linear way, and we have to have incentives to make people go forward and have a collective gain in population health.
Well, it certainly seems to be the problem, and I think going back to Soham, what you talked about with people never follow doctor's advice, is that changing people's attitudes, changing perspectives is one of the most difficult things to do in some ways. And I think that we talk about cultured meat. That is certainly one thing that people seem to be much more resistant to for lots of different kinds of reasons. I think I'd like to ask, guys, now we're coming close to the end. Like, what do you think you'd like to see happen next, or what do you think needs to happen next? Chaitanya, let's start with you.
Yeah, I just want to complete that. I know it's quite hard to change someone's behavior, but we do understand right now we get influenced quite easy. I think this is proven fact. We have Instagram, Facebook. We see things around. We do get influenced. So influencing the change of behavior, that's quite possible, and this is quite data driven as well. So, and that's scary. There is some gray line there. What we all should agree, and also coming back to one of the questions yes, theoretically, yes, we should invest more into cool technologies. If we can produce meat out of mushrooms, perfect. But then you should also buy that. Someone needs to eat it. Otherwise, there is no loop in the investment. Otherwise, it's just going down the rabbit hole. So we need to change ourselves first to change the things around. And I think if we are more responsible as a consumer, change do happen around. Then all industries get aligned automatically. There need not be a top-down approach, as you rightly mentioned, Soham. It has to be the bottom-up approach. There has to be demand. So this is my stand on this.
Yeah, Chaitanya, you saying that everybody here should try to change? That seems like that's a big ask. So everyone should go out. Okay, I think that's a reasonable way to start. Let's talk to one of the influencers. Sara, tell us as a podcaster, what would you like to see happen next? What do you think needs to happen?
Well, what I would like to see is that more areas integrate One Health, especially in design and in businesses and architects. I would like to see all of this conversation going on. So when we design a new building or a new business, if we can think, are we harming the environment, the animals, or ourselves, our healthcare, so that we start really integrating this as a mindset in whatever we build. And this is something that I'm really interested in and that I want to contribute more. In terms of my podcast, that's just a small scale project that can inspire some people if they like to listen about One Health. So I'm starting the second season soon. But I would like us to move forward from this discussion of who has to take responsibility, but rather integrate it as this is a common mindset. And when we design businesses and when we design something, that we think in these three perspectives.
Well, I think that's one of the things I wanted to ask is how can we impact how can healthcare systems impact One Health? And one thing you mentioned to me earlier on was to ask the question, what harm are we doing? Any business that we start up, any venture that we try, any job that we work in is like, what harm are we doing? And how does it impact everybody else? Soham, maybe you could talk that as well. Like, how do healthcare systems, what can impact can they have on this concept of One Health?
I think it's in health we always say it's always nice to act before the disease sets in. So if you can screen it, even better, prevent it, that's so much better than diagnosing it and then treating it, right? So I would say at this moment I would like just add to what Sara said. It's very important that we integrate these different systems, and it's not like one sector's responsibility, it's everyone's. And a bit on what Chaitanya said, the influencer culture or the Instagram or something like that, I think it's very essential. Look, we all have the information's out there, there's nothing hidden from the world now, but what information are we consuming? Is it responsible? Is the person who's putting it out there, is that person responsible? Can we make that person accountable for the information? Because there is so much rubbish literally on the internet, and people consume that. And then I sometimes when I take lessons for master students, they come up with very strange comments, and I'm like, where did you get this from? And they're like, Wikipedia. And I'm like, you can't take that into a scientific evidence thing, So I think it's very essential that we, in this age of information, what information we put out there, it's very important we make these people accountable in a way. And also the kind of messaging, it should not be doomsday messaging. We have to bring everybody on board. We can't keep telling people that the world's coming to an end. even if it is, because then people are going to get very discouraged from it. And that's something I think I addressed in my podcast as well, that with my co-founder, I remember we had this conversation. She was like, no, we want to reach so many people. The granny sitting in Spain needs to listen to this, and then la la la. And I was like, look, for me, honestly, if the listener just takes it to the dinner table and tells her family, I'm good with it, because that's how you spread awareness. That's how you start with like systemic change. So I'm a positive. I'm a dreamer. I like to see it in a very positive way, where I think there's a lot of people working in different sectors. You just have to like connect them and make them accountable for the information they're putting out there. And then there's we're looking towards a better tomorrow.
Yeah, and both of you guys, your podcasts are in the chat as well. Like, we've got links to both podcasts if anybody's interested in checking that out. Bernardo, you have the future Dr. Gomez there as well with you.
Yes.
Tell us. I saw you laughing. How do you monetize preventive healthcare? Was the last question. I don't know if you want to take that, Bernardo.
I can take that, because I was thinking the first companies that detected the signal that was the first signal this pandemic was a private company. They work for government. So they had the social listening skills with proper software and proper competences, and they heard the right signal, they analyzed it, and they were the first to detect it. So what I want to say in One Health, just 2 or 3 remarks that I think they are more important. One, I'm looking forward to try to put One Health in agenda at a local level, like starting, because all of us are very sick of discussions that are very theoretical and without moving forward. So one of the things that we're trying to do at the political level, at the local level, is organizing, for example, at the county level, that all sections regarding to One Health, human, animal, environment, and social, are all beneath the same person in political level. It's easier to work like that and work in an integrative way. Second is to try to overlap knowledge of functioning of veterinary and human institutions, for example, environmental, to know where we can add value. One of the things that bothers me the most is veterinarians or other professionals, environmental technicians or engineers, have a set of competences that can be very useful for me as an epidemiologist in public health. I don't know everything. I don't. Yes. I don't deal with the public. I don't deal with spatial mapping every day, or spatial epidemiology. I don't deal with machine learning every day. So we have to take advantage of each other's competences. Okay, this is one of the things that I want to say. And thirdly, I think there are things that are being done at the European level. This is another example. And what I wanted to say at this point is we can point towards specific objectives to try to guide an overall interaction. One of the things that Sara and the others are saying, we need just, one of the things that is obvious, and I thank you for this opportunity, is creating focus where we can share experience and show this exists, but we have to show practical examples of gain. And one of the things that I wanted to speak for the people in technology, I was speaking about signal detection and machine learning and algorithms and things and like that, and that will be more and more important in pandemic prevention. I wanted to add another thing so simple as, for example, we cannot have animal and human authorities depending on receiving signals of detection and warnings based on emails. We have to have an app that is like of a new universal design, that, for example, a case of Brucella in a certain area has to be broadcast for every human and animal authority in that area. Okay, in the sense that speed is very important. One of the and just to finish, in the pandemic, one of the errors that we've detected is the slow communication between authorities because of bureaucratic arrangements. So technology can resolve and can add value in that sense. So even from the entrepreneur side, there are hidden gems and hidden gains that an entrepreneur can contribute. Thank you.
Thank you, Bernard. Thank you very much to the panel, guys. I'm conscious we're slightly running over. I'd love for us to continue this conversation. So please stick around, have a chat. I guess you guys are going to hang around and be in the lounge a little bit later on. Is that correct? Yeah. So if anybody has any other questions, any other comments, please do join the panelists in there. But thank you very much. Certainly true, the old Chinese curse that we live in interesting times. Thank you, guys. We're going to end this session. Please go into the lounge, have a chat with a few people. I guess we'll probably run a little bit late going into the next session. I'd love to give you a few minutes just to chat to each other and catch up. So thank you for joining this panel, and talk to you all later.
Thank you for having us, Declan. It was a